My name is Thomas Glessner. I'm an attorney and president of the National Institute of Family and Life Advocates, also known as NIFLA. NIFLA was founded in 1993 as a legal program for pregnancy resource centers. As such, we've developed legal programs and materials to help PRCs understand the requirements under which they must operate and to equip them to make sure they're in compliance with these requirements. Our central mission is to promote and secure adherence to the variety of professional legal standards that affect PRCs, from medical standards regarding the use of ultrasound to licensing issues to nonprofit board issues and accounting standards. In 1995, NIFLA worked with other national organizations, specifically Heartbeat and CareNet, to establish the commitment of care, which sets forth the fundamental principles of operations for PRCs nationwide, some of which we've already heard about today. In 2009, these national standards were revised to include standards for PRCs that are medical clinics. New commitments were also included as well to encourage centers to rededicate themselves to compliance with legal standards regarding areas such as employment policy, fundraising policy, taxation, public reporting, and disclosure. Through this revised and expanded commitment of care and competence, signed on to by all three national organizations who are here today and 10 other national organizations that offer affiliation opportunities, medical services are also provided in accordance with pertinent medical standards. This means that ultrasound services offered in medical clinics are provided under strict national guidelines issued by the American Institute in Ultrasound Medicine, AIUM, the American College of Obstetricians and Gynecologists, ACOG, and American College of Radiology. The legal reviews offered to PRCs have a similar purpose across a wider range of concerns. They begin with an audit of the center's practices to examine that it's in compliance with all the legal requirements. It also includes follow-up with on-site legal training, board training on issues that need to be looked at by the centers that have legal technicalities. And all three national networks here today, CareNet, Heartbeat, and NIFLA, offer legal reviews and legal audits for their affiliates. To date, these groups have performed over 1,500 legal audits to pregnancy centers across the nation. NIFLA specifically offers follow-up through its monthly bulletins called Legal Tips and Clinic Tips, and CareNet offers monthly legal care advisements to their centers as well. In addition to these legal reviews, the three major networks here today offer on-site legal training for board, staff, and volunteers at PRCs. In the 1990s, NIFLA began to work with pregnancy centers to help them convert operations to medical clinic status. Today, as Sandy said, there are almost 700 pregnancy resource centers that operate as medical clinics across the country. We discovered at that time that PRCs that provide medical services, specifically ultrasound services to confirm pregnancy, were experiencing dramatic growth in the number of clientele being served. Accordingly, we launched a major initiative to provide legal help to pregnancy resource centers in making this conversion to medical clinic status. As part of this initiative, we founded the Institute in Limited Obstetrical Ultrasound, which is a medical course that trains nurses, physicians, and other healthcare professionals in the legal guidelines for provision of limited ultrasound. This course, based upon national guidelines from the organizations I've already mentioned, provides continuing education units for nurses, and to date we've trained over 1,200 healthcare professionals, specifically mostly nurses, in the provision of limited obstetrical ultrasound in pregnancy center settings. You know, I've been involved in this movement as a professional attorney since 1979, and through these many years I have witnessed firsthand the growth and maturation of these small charitable agencies that provide services free of charge to people in need. The unselfish, caring work of these agencies, in my mind, represents the very heart and soul of this nation. 100 years, 200 years, 300 years, even 1,000 years from now, historians are not going to judge our current society by our military might and by our great economic strength, but rather we are going to be judged by future generations by the amount of compassion and care we gave to the most vulnerable of our members, the least of these brethren. Today, the pregnancy resource centers are providing care and compassion to the very least of these. And so I'm very proud to stand beside the Pregnancy Resource Centers of America, and I can say with absolute passion and conviction that the pregnancy resource centers across the nation truly represent the highest of American ideals and exemplify the best of the American charitable spirit. Thank you.